here's the thing. We know exercise is key to help prevent severe COVID-19 outcomes. Doctors say outdoor workouts are safer, so we're not breathing in recycled air.
But as we get closer to the winter months, more people are considering the gym. Question is it safe?
An infectious disease expert from UVA says it's a risk, but keeping a mask on the entire time you're inside the gym, even while you're working out, can help keep you safe.
Thanks, Jessica. It really is important to keep your mask on the entire time that you're working out. 6 feet is like the minimum distance that you should be close to anyone. And it's best to do like solitary workouts. I think like the classes inside a closed space are going to be riskier than individually working out on a elliptical or a treadmill.
What is the trajectory of any droplets or their breath, and how can that put you in harm's way if no one's wearing a mask?
Yes, it definitely does put the other people in the gym in harm's way if you're not wearing a mask. I know it's hard to do while exercising, but it's really essential in an indoor space like that because you're going to be exhaling both large and micro droplets. Everyone really does need to wear a mask, though, indoors because you're just putting other people at risk if you don't do that.
Are you at risk of causing another health issue by keeping the mask on for so long while you're working out?
No, I think the only problem is it's uncomfortable having a mask on while you're running or exercising, but there's no risk of like retaining carbon dioxide or any other sort of health consequences from it.
I wear the 3-layer mask that you find like at Walgreens when I'm out and about. Then I've seen people with the masks that have like the little filters on them that kind of look like the Bane mask from the, from the Batman movies. Are those masks that have those filters on them, are those safer when you're working out indoors at a gym, or do the, 3-layer masks that you might find at the drugstore, are those just as safe?
All those work fine for what we're trying to do, which is to prevent like droplet aerosols going from one person to someone else. The vented masks, though, are not safe for other people. So if it has like a vent that's, it makes it easier for you to breathe, and some of the N95 masks have vents on them. So those work well to protect you, but they're not protecting other people because there's unfiltered air that's going out through that vent. Jessica, I'd also say like that there's probably some people that should not be going to a gym. And so if you are 80 years old, you're 20 times more likely to have severe COVID-19 than if you're 50. So an 80-year-old should, I really think twice about going to a gym. And if you have an underlying medical condition like diabetes or heart or lung disease, that's another reason that maybe being in the gym is riskier than it is for a 20 to 50-year-old healthy person.
Now, in those cases, Dr. William Petrie urges those people to get out and walk, do some at-home exercises, because moving the body is still a way to prevent severe COVID-19 outcomes. Now, if you do go to the gym, he says try to go during off-peak times, and even though staff are supposed to be wiping down equipment, he says it's a good idea to bring your own supplies and do it yourself too, just to make sure. And again, wear the mask the entire duration of the workout. Don't rip it off once you swipe in at the gym and get to the machines.